Hi, I'm Dr. Bill Nicol. My practice is Body Integrations Chiropractic. I've been a chiropractor for 27 years, and today I want to explain to you why it's important to keep your spine aligned on a regular basis. Once I get people out of pain, I recommend my wellness program where I have people come in once a month. I assess the spine for misalignments, fixations, and adjust those that need to be adjusted. And that's important because it affects the nerve roots if they're not. I've been doing this for 27 years. As I mentioned, I've had some people on this wellness program for 20, 23, 24 years, and they're coming in because it works. Now, the experience is after about 3 weeks, our muscles just tighten up, everything kind of tightens up, and then people will come in, we adjust everything, and then they're loose again for another good, going on 3 or 4 weeks. And it's important also to note that people who don't get their spine aligned, they just get accustomed to their tightness, so they don't know the difference. So I recommend people try the wellness program for a couple of months to see what it feels like to have the spine moving freely, and then they tend to want to stay on the program. Now, why is all this important? Well, when the spine is not moving properly, there's misalignments, and that causes abnormal wear and tear on the joints and wears them down. It compresses the nerves, the nerve roots going out to the muscles and organs. That can cause tingling, numbness into the extremities, and pain. So it is important to keep that moving freely. And I want to show you what that looks like on this screen here. This is an example of proper alignment looking from the back to the front. And when it's not, you can see worsening here. It's getting crooked, and this is compressing the spine right in here, and that's compressing those nerve roots even further, and that can affect the nerves going down into the legs. And if it continues, it gets worse, and you get severe degeneration. Osteoarthritis is what it's called, and that can cause a lot of problems. Looking at the side view here, we'll look at the head. So you can see that head is moving forward. It's called head anterior weight bearing, and that's compressing the nerves in the back here, and that affects the nerves going down into the arm and organs, and also functions up into the head. And then when you get adjusted, it straightens back up, and we keep things moving as freely as possible. Looking at the nerves. Now this is an example of the cervical spine. This is the natural curve in the cervical spine, the neck. These green flashes are the nerves firing, so they're all firing properly. And then when they get fixated and stuck and not moving freely, it causes that degeneration I'm talking about. You can see it's starting to flatten out, straighten up, and compress. So it's compressing each of the discs and flattening them out. And then you start to build up these bone spurs. And phase 3 is even worse. You can see these bone spurs sticking out. These bone spurs are also in the back of the spine here. You can't see it, but that's where the spinal cord is, and that's where the nerve roots come out. And that's when it really compresses those nerves, and you don't get full nerve innervation going to those muscles and organs and causes problems. We'll look at an x-ray. Here we're seeing on the left here, this is a natural curve in the cervical neck. You'll see the vertebrae and the disc. That's the black in between the vertebrae. That's the disc. And so you have good height there. And so you'll have no compression on the nerves. Then over time, when the neck is not aligned properly, you'll get this degeneration going on. You'll see these heights are shortened, smashed kind of in between the vertebrae. And again, that's pressing all those on those nerves coming out of your neck. So that's why it's real important to see a chiropractor and and see if they have a wellness program. And I'd recommend you do that once a month to keep things moving as normal as possible. So I thank you for your time, and I hope you find that this video was informative for you. I'm Dr. Bill Nicol.